in methodological way. So our objectives for today is to know about the PDSA, the plan, do, check, and act, then when to use the PDSA, and the quality improvement in practice. So the PDCA plan, do, check, also known as the PDSA, the deeming well, and the Schwartz cycle. It is a methodological procedure for acquiring important learning and knowledge for the ongoing improvement of good, process, or services. This integrate learning improvement paradigm, also referred as the deeming well or deeming cycle, was first presented by Dr. Deeming by his mentor, Walter Shewart of the renowned Bill Laboratories in New York. So Dr. Edwards Deeming, a management consultant, created a technique in pinpoint for the reason why some goods or procedures don't perform as expected in the 1950s. His strategy is now widely used as a tool for strategy by the wide range of enterprises. They can develop hypotheses about what needs to change and test then in a constant feedback loop. As a result, with the PDSA cycle, you can solve problems and implement solutions in rigorous methodological way. Let's go. Let's see the diagram. So let's start with the plan. Plan is find and note down the opportunities, analyze the problem that are present. Plan changes the step to be made and the findings, your findings and problem. This stage involves planning the end goal and the process to be followed to reach it. In case you are looking to improve or solve a problem in an existing process, this is where you gather all the necessary information and steps that might help resolve the issue. This stage, a lot of analysis to find out causes and fixes the issues you are currently facing. So next is the do. Implement the solution, ideally or on a smaller scale or as a controlled test bed, or note down the observation and findings. So this stage involves implementing the fixes and the solution that materialize during the planning stage. As a precautionary measure, it is recommended to implement the changes on the smaller scale as a test to find out whether the solution proves to be useful or not. This is where you can benefit from the setting up and implementing your changes in a small controlled test environment. This not only helps provide insight into the effectiveness of changes, but also better understand why the outcomes improved. So next is to check. Study your findings and observation from your testing phase and make changes to the step as necessary. So this stage involves checking the results obtaining from your trial runs for changes and to improvement. If there is still issues or problem arising, then find out the causes and to come up with a better solution. In this stage, it is advisable to ask the following questions. Gamay raman siya na questions, but it helps Jud. Will the produce changes work as a larger scale? Did the changes work? Did the changes work? If there is opportunities, can the plan be further refined? So this might be seems trivial, but checking helps avoid further mistakes down online and when the change is implemented on a larger scale. So mo to siya plan, do, and check. Then after you act, implement and improve the process. This is the final phase where the recommended changes to untested processly are finally implemented in their entirely. But though this is the final process, the cycle does not end here. In case there is a further changes to be made, observation from this step are to be taken and the cycle is to be restarted once again, then you restart from the plan. So this PDSA cycle is the followed until necessary expectations are met. From there is no necessary as further changes down the line. Like for example, ganina example ni Ma'am Unabia regarding sa flowchart, if kung inyo itong i-revisit kay jud na siya problem, you can use the PDSA na cycle. So next is When to use the PDSA. So framework works with all the types of organization. It can be used to improve any process or product by breaking them down into smaller steps and develop stages and exploring ways to improve each one. It is particularly helpful for implementing and for improving business processes generally. However, going through the PDCA or PDSA cycle can be much slower than straightforward. So, yung GOHO implementation. So, meaning sa GOHO is your energetic. Then, so it might not be an appropriate approach for dealing with an urgent problem, but it also requires significant buy-in from the team members and offers fewer opportunities for radical innovation, which may be what your organization needs to instead. So next is quality improvement in practice. So improvement in patients' outcome, system information, and professional development that is results from the combined multidisciplinary approach in how change is delivered. The delivery of healthcare which improve outcomes and lower costs through continuous redesigning of work process and system. Then using a systematic change method and strategies to improve the patient's experiences and outcomes, then to make the difference to patients by improving the safety, effectiveness, and expresses of care by using the understanding of our complex healthcare environment by applying the systematic approach. And designing, testing, implementing the changes using the real-time measurement for the improvement. So sa ato ang quality improvement in practice, na siya yung mga qualities in quality improvement. Let's start with the primary intent to bring about the measurable improvement to a specific aspect of healthcare delivery, often with evidence with theory or what might work but requiring local iterative testing to find the best solution. So next nato is employing an iterative process of testing change ideas, adopting a theory of change which emphasizes a continuous process of planning and testing changes, studying and learning from comparing the results to a predicted outcome, and adapted hypothesis to response to a result of a previous test. So next is the consistent use of an agreed methodology. Many different QI methodologies are available. Commonly cited as methodologies include the model of improvement, Lean, Six Sigma, and experience-based co-design. Systemic review shows that the choice of tool or the methodologies has little impact on the success of a QI, provided that the chosen methodology is followed consistently, though there is no formal agreement on what the constituents of QI tool. It would include activities such as the process mapping that can be used within the range of QI or methodological approaches. The next is the empowerment of frontline staff and services users. Um, QI QI work should engage staff and patient by providing them with opportunity and skills to continue to improve work. Recognition of this need often manifest in drives on senior leadership or management to build the QI in capability in healthcare organizations. But it also requires that the frontline staff and the services users feel able to make sure of these skills and take ownership of the improvement work. So next nato is the using data to drive the improvement. To drive decision making by measuring the impact of tests of the change over time and understanding the variation in process and outcomes measurements for improvement quality priorities. This narrative approach over concerns around exactness and completeness of data. Then the last is the scale up and spread with adaptation to the context. So as intervention tested using the quality improvement approach are scaled up and degree of behalf in their efficiency increase, in it is desirable that they spread outward and be adopted by others. Key to success, the fusion of improvement is adaptation of intervention to new environment, patients, and staff grounds, available resources, and even personal preferences of healthcare providers in surrounding areas, again using the alternative testing approaches. So, taking consideration actions to change of healthcare for the better is not new, but QI as a distant approach in improving the healthcare is relative recent development. These are many well-established approaches but to evaluating and making changes to healthcare services in use, and IQ will only be adopted more widely if it offers new perspective or an advance over other approaches in certain situation. So a non-systematic literature can identify the following other approaches for making the changes in the healthcare: research, clinical audit, service evaluation, and clinical transformation and innovation. We also identified innovation as an information catalyst for change, but we do not consider it as an approach to evaluating and changing the healthcare services so much as a catch-up all terms or for describing the development and introduction of new ideas into the system. Many have elements in common with QI, but there are important differences in both intent and application to be useful to the clinicians and managers. So QI must be found a rule within the healthcare that complements research, audit, and services evaluation and clinical transformation while retaining to the core principle that differentiate it from these approaches. So ato siya ang alternatives to quality improvement is kaning five kabok. So ako ni siyang isa-isa ko sa research. The attempt to desire generalizable new knowledge by addressing clearly defined questions with the systemic and reduced methods. Clinical audit, a way to find out if the healthcare is being provided in line with the standards and to let care providers and patient know where their services is doing well and where there could be improvement. The next is the services evaluation, a process to investigate and the effectiveness or efficiency of the services which for purpose general information of local decision making about the services. So clinical transformation is an umbrella term for more radical approaches to change a deliberate planned process to make dramatic or reversible changes to how care is delivered. And lastly is the innovation to develop and deliver new or improve health policies, system, products and technologies and services and delivery methods that improves people's health and health innovation response and meet needs to employ new way of thinking the working. So mao to siya in the setting magud sa atong hospital magamit jud ni siya ang kaning PDSA. So for example sa katong flow chart if inyo like for example murag dili na siya kanang what you call this, dili na siya murag effective na ang inyuhang flow chart murag nanay changes because of like mga sa katuang pandemic na ay changes sa atong mga kwan din lahi ang atong administration lahi ato ang kwan din they need na like for example na tig-release sa MedCert kung madugay na siya like days na siya diha sa ka-unit na katong kuan dapat ilang i-revisit para ma-improve siya na ma-release ang medical certificate sa within the day. Kay as what I have kana experience manggod sa CCMC kay as of now the EOC of the Cebu City the doctors there are connected naman sa CCMC. They are there to put a new public health unit sa CCMC, so they revisit all the flow charts. So after that they do then they check then they implement they act. So mao to siya ang ato ang kanang examples for the PDSA. So who can share me more examples sa PDSA? Anyone? Morning, good afternoon everyone. I know na kanang tingduka jud ro na day, tingduka ro na time. Guys, wala. Kamingaw, oy.
Plan to do study actor, no?
PDSA, Ma'am Unabio. Kani si Ma'am Unabio, ba, grabe dyan siya ka-active. I love you, Jud, Ma'am.
No, actually, because I'm very interested with the subject, that's why.
Mm.
Very interesting man good. Anyhow,
Plan,
plan,
do,
do,
check, and act.
study, and act.
Mm.
Mm, actually, nalang ko example nga ika-share. Actually, this is with regards to our, because there are some policies in the hospitals. It doesn't mean it's a policy, then it should be there and then that's it.
Yes,
Because I
yes.
believe policy should be revisited. If it needs to be modified and if it needs improvement, then we should do that rather than implementing it and then that's it, you know. That's why we need to evaluate them every now and then how effective they are. Anyway, with regards mong goods, we have this policy on medication returns bitaw. Kay there are
Okay.
some patients manggod who do returns like after a week na they purchase the medicine, which is actually major questionable because we don't know the storage and the handling, you know. Are you getting me, sir? Anyhow,
Ma'am, yes, ma'am.
so yeah, so dili mata sure kay yung giuli sa balay nya, you know, wa pakibaw kung maon na bagyod na siya ang katong ilang gibay sa among pharmacy sa hospital. So we have this policy about that medication returns, but we implement it not in general population of all of the patients. So we have this thing in which we will apply that said policy to inpatients who are on cash basis. Why? Because cash basis patients actually will affect our accounts cash flows. Because like for example, nipalit sila sa meds nga cash. Inpatient sila ha pero like close account or something so nagpalit sila cash. And then ilang iuli. So kung once ilang iuli, what will happen is maguba ang cash flow sa among accounts because mo refund man sila. So, medyo complicated siya. So, maunang, gi-allow siya nga it should be within 24 hours since the accounting staff also are doing their thing in a day man. So, if mauli siya, so dili ra gyud siya somehow makaguba sa cash flows. And then, secondly, we have this thing na dili siya because some of the our nursing supervisors, they said no roads because it's in the policy. Like you cannot have you should implement that 24 hours for everyone. So I was like no, because if you are the patient, put your because I always put myself actually on the patient's shoe bitaw, which is I have to know how would I feel if I will be the patient, which I won't be happy if you will implement that thing to me. Like I am not a cash patient, I am admitted, and then I have this discontinued meds, which the nurse wasn't able to return on time because they're busy, they are having a lot of workloads and patients. So I understand because I'm also a nurse. So if they're not able to do that, I won't be happy if the nurse will come to me and tell me, "Ma'am, this medication you cannot use anymore. You just have to keep it." So my question is, no, you return it because I'm still inpatient. I'm still staying here in the hospital. I'm not discharged yet. In which, kung i-generalize ang pag-implement sa policy nga, it will also affect me, then I won't be happy. So that's why I told him, it should be specifically mentioned that that specific policy should be applied to cash patients only who are inpatients and as well as those outpatients, of course, because they're buying from outside and then going to the hospital just to buy the medications. But for inpatients per se who are not cash patients, then I don't think that you should, you know, implement. And it's actually kind of somehow a good thing because first, I have this belief, Manggod, na I'm not a solution person, but a prevention kind of person. So I always look things ahead, possibilities ahead, what should happen, what will happen if this and that. So I look around, left, right, back, forth, up, down. What are the possibilities before I do decisions and do things, rather than can bitaw you're in front of your boss and you just have to approve, or you just have to say yes, and which no, bitaw. So that's why a plan, you should think about it first, use your critical thinking, do and study and act. I think sakto ba,
Yes,
sir?
ma'am. Yes, ma'am. Yes, ma'am. So, thank you, ma'am Nadia. So, Doc, moro to ako ang topic. So, next is si Miss K. I think so si Miss K.
Okay, now, so the question is, when can we use the PDCA or PDSA cycle, no? Well, we can always use this one in the context of research, guys. We happen to know that this is a kind of model. It's a framework that is being used for quality assurance program. So if you are research, if you are into quality assurance program, quality improvement, continuous improvement plan, the PDSA would be the perfect framework or model that you can anchor into your theoretical background. So that's also one of the great three one of the important thing that we have to consider in terms of PDCA. What are the components that we're actually studying in the context of research? Because that's the only thing that I can think of right now in regards to academics and research in nursing, no? So probably we would like to know if what are the level of usage of continuous improvement strategies, no, for hospital employees or to our nurses in terms of supplier development. How do these individuals trying to have a good relationship with each other? The processes, probably the nursing process that are being implemented in our hospital with our staff nurses, total quality management. When you talk about total quality management, this was already been discussed with the previous reporters, has something to do with making it sure that we manage it properly. We have to consider the time, the resources that we do have. Another thing is our customer relationship, which was just tackled with this day for the report. The human resource, particularly with the nursing, that's part of continuous improvement strategy. The system, how are these policies are well implemented? Leadership, organizational leadership is very important. And also, how do we promote a good culture when it comes to continuous improvement plan? So this can be under one variable or subtopics that we can consider with PDSA framework or model that we can anchor in it. And for this, our main target participants for this particular study are, of course, our staff nurses, perhaps, or our nursing supervisors or managers. Then we can come up with a very good plan. That means to say that at the end of the research, there should be a continuous quality improvement plan that we can utilize. No? Kana siya. That's one of the major use of models. Okay. So in your theoretical background, it has something to do with a conceptual framework or conceptual model that your study can be anchored. Aside from the theory, you can also utilize theory, no? And what's the difference, man, when you utilize theory versus a model and a framework? When you talk about model and framework, it has something to do with a lot of discussions if you're just looking into the diagram. However, you're going to explain that in your review of literature. But when you talk about theory, what are the foundational theory of your study? No, it can be a nursing theory, perhaps a management theory, no? But I really suggest that there should be one nursing theory that you will be anchoring your study as well. Okay. Kana. Okay. So who is our next reporter? By the way, before we proceed with our next reporter, any questions coming from Arbel? Arbel's report? Ala na.
So far.
None so far. Okay. Sige, so Mr. Nabio was able to give an example in the hospital, but in my end, in the context of academe and nursing research. Okay. Arbel, who's next to report?
Me, Sir Miss Labiste.
Okay. All right.
Okay, so
Okay.
good afternoon. Allow me to share my slides.
Guys, should you want to use the activity button, you can use that one through QA, through polls, kung ganahan mo, no? Nata din. And also, if you want to break them into a smaller group discussions, you could, no?
Okay.
Sige, but
So,
anyway,
makita.
yes, it's visible in our end, okay?
Okay.
Kuan lang
So,
siguro, ikuan siya, slide share, slideshow.
kana, sir.
Ah,
The
wala pa siya.
slideshow na nako. The
Ano, slideshow
slideshow na
siya.
na.
Kanang i-try ko no move kay ang imuhang slide.
Di siya mo kuan, sir. The
Ani
slideshow
siya,
na nako, sir.
wala
Remove
siya
na
ni
nako.
slideshow ko mong end daan lang
Uh,
gyapon siya. Oh, here na siya, sige.
okay.
Go ahead.
So, good afternoon, everyone. So, my name is Kay Patricia Villano Labiste, and I will be discussing the quality improvement in nursing, nursing quality indicators, and flow chart. So, first is what is quality improvement. So, I think no. So, nag-discuss na ni sa previous reporters. So, it is the systematic approach that is guided by data to improve the quality and safety of healthcare delivery. So, when we say systematic approach, so it is a process based on the application of clearly predefined and repeatable steps. So there are five components of quality improvement includes. So Ms. Kim Sato discussed this. So the problem, the goal, the aim, the measures, and the analytics. So nursing quality, so it is an integral part of healthcare quality and one of the performance indicators for for healthcare management. So nurses are directly involved in almost aspects of hospital quality, including patient care, bedside, and medication management, assistance with surgeries and data collection and reporting and more. So furthermore, so nurses are directly responsible for monitoring, assessing patient and performing immediate intervention to reduce risk or prevent medical complication. And it is initiating deployment of appropriate and timely care to aid patient in this situation. So, nursing quality improvement project ideas and guide on improved nursing care. So, ako lang siya skip because kanang na-discuss na po ni Miss Kim Sato. So, I will move to the quality improvement in nursing process. So it involves review. So review the data of patient and other medical data, then evaluate nursing performance or analyze process used to provide care. Then using that information, so they work to identify the areas of improvement and it highlights areas of excellence. Then after identify areas for improvement, they will formulate goal and the goal of this work is to improve patient care outcomes and work environment. So actually, I honestly know so di kay ko ka-relate sa hospital setting but if I relate na ko sa community setting, so amo hatag example sa amo ang annual performance implementation review. So in our PIR, so we review the data. So ang community setting is more in reports man siya and health promotion. Then naasad mi nami mga deliverables nga ma-reach yan nami mga target ang mga programs na among i-accomplish kay ang DOH naman na sila i-target. So i-review na mo ang data from previous year to present, then amo siyang i-compare if kanang ni-increase ba siya o decrease. So by that, so ma-evaluate ang nursing performance ana. Then human, then i-ma-identify na mo ang areas kung asa siya nga na-improve o asa siya nga ikinanglan siya i-improve. So for example, so low siya sa in TP, so sa TB, so case detection rate low siya, so mo na among himuon og kanang action plan. Then that action plan, so mo na siya ma-improve sa patient care and work environment. So this na mga several tips for effective quality improvement process that we should remember. So includes focus on improving the systems, not on individual mistakes. So leaders need to establish a culture in which people continually look at improving the systems rather than punishing people. So then second, focus on outcomes, not just process. So improving process can be an important part of quality improvement in healthcare. So third is still pay attention to the underlying systems. Then fourth, listen to patients. So this is the most important thing, is to listen to the patient because and concerns, because sometimes if we are irrational, so we don't take the time to pay focus attention to what they are trying to tell us. So they are frightened, anxious, and often to do not understand what is happening around them. So by listening attentively, so we gain their trust and able to go beneath the surface, learn their concern and fears. So by that, we can develop an effective plan of care based on a complete understanding of their mental and physical states. So this will save more medical errors than anything else. So dagan pa siyang mga effective. So maratong ako ang So next is the nursing quality indicators. So this is are standardized evidence-based measures of healthcare quality that can be used with supportive administrative data to measure and track clinical performance and outcomes. So, in the domain of healthcare, good quality services are generally defined as services that are effective, safe, and secure, patient-centered, coordinated, and characterized by continuity, then utilizes resources and available and fairly distributed. So the transparency about healthcare performance and outcome is important for all patients and their relatives, health services, and the health authorities. So the quality measures, so the quality indicators are divided into three main types of quality measures. So first is structure indicators, next is process, then third is outcome. So in structure, so it characteristics of community, institution, provider, and patient. So the underlying assumption of this measure is that healthcare organizations that have necessary quantity and quality of human and material resources and other structural supports are best prepared to deliver quality healthcare. So, for example, this is nurse staffing, qualification of nurses, characteristic of nursing practice environment. So next is the process. So it is an intervention activities process. So example is assessment and implementation of patient care requirements, management and implementation of nursing intervention, then documentation of nursing care plan. So next is outcome. So it is end results of care. So quality measures has focused primarily on outcomes. So structure and process measure provide important insights, illuminating which areas to address to improve outcome. But the situation na to karon no is I need na to i-address yun is ang structure, which is the nurse staffing. So sa garan siguro sa hospital when is understaffed. So if dili lang jud understaffed, maka-provide na bedside care or quality care sa patient and ma-assess and ma-implement na taro ang patient care requirements. So by this, nindot sad og outcome. So improvement, for example, improvement in function, recovery or survival, patient safety, length of stay and mortality and pressure ulcer rate. So, alright, so let's go to the 7 basic tool of quality for process improvement. So first is flow chart, second histogram, cost and effect diagram, chart sheet, the scatter diagram, control charts, and Pareto charts. So flow chart. So it is a graphical representation of the operation involved in the data processing system. So this is the best way to understand a problem is to draw a diagram. So diagrams usually gives us more complete picture of the situation than a short set of words or phrases. So however, so the combination of visual by symbol, shape, and text provides a very powerful tool for communication and problem solving. So flow chart is different from algorithms, no? So before nagtuod ko nga same ra sila, but I realized lahi ra jud ay siya. So flow chart are much easier to understand than the algorithm. So this picture, so mao ni siya ang flow chart with symbols or shapes. So ang kanin siyang oblong, mao ni siyang the terminator symbol. So it represents the starting or ending point of the system. So the process or a box, it indicates some particular operation. Then ang diamond so represents a decision or branching point. Then lines coming out kani siya. So out from the diamond indicates different possible situation leading to different sub-process. Then in data or in parallelogram, so it represents information entering or leaving the systems. Then a document, this represents printout such as a document or report. And the lines represents the flow of the sequence and direction of a process. So why use this method? So this is to build a common understanding of a process, then to analyze processes and discover areas of issues, inefficiencies, blockers, etc. And to understand uh, and to standardize process by leading everyone to follow the same steps. So how do you effectively use this method? So first, identify the boundaries of the process, then clearly define where the process under discussion begins and ends. Then team members should agree on the level of detail they must show on the flowchart to clearly understand the process and identify the problem area. So mo ni siya important so dapat team members is involved siya ani nga maghimo og flowchart. So mo ni siya example sa flowchart. So actually, nagawa po ko ani sa Google. So it shows how clinical cases shall be processed, and this flowchart uses decision diamond shape intensively in representing alternatives flows. So actually sa mo ang RHO kay wala kay ko kabantay nga naami ingani. So practice the philosophy of continuous improvement, get a little bit better every single day. So we need to continually strive to get better at what we do, such as make never-ending improvements to our works process. So I think that would be all.
All right. Okay. Do you have any questions for discussion for the group to answer? Do you have something to ask them in terms of application?
None so far,
Okay.
though.
How about Kay? Do you have any questions for discussion, Kay? Wala? Sige. So since Kay don't have one, I'll be the one to throw a question for our discussion. So based on your organization, what have you noticed in terms of your procedures and also your protocols that are being implemented in the hospital? What type of tool are you utilizing? Were you able to see those particular diagrams as shown during the report? Let's have yes, let's have Unabia and then followed by Tudtud.
We have this flow chart.
Okay.
Uh, like for example, in our OPDs, which actually just recently they also revised and modify um, something in the process because our OPD actually is located in our lower ground. So in our lower ground, our pharmacy, our OPD, pedia and adult, our eye center is there. And then above it, in the upper ground, we have the laboratories, the cashier, radiology, the diagnostics, like the cardiology, and the ER. So we've decided with the previous flow chart man good in the flow of the patient. Once the patient comes, what's the process, where to go, what to do, that kind of thing. So previously the patient used to go upstairs just to pay for their medicine before they can get the medicine down, because our pharmacy is in the same level with the OPD. So what they actually do, because they've noticed that everything should be actually in the lower ground, since OPD is in lower ground, so everything should be done there rather than the patient going up and down. So what happened, they decided to um, uh, have some staff from our cashier and billing have an area there in our OPD which they could cater the patient. So the flow now is somehow smooth na bitaw. Unlike previously nga, once the patient had their consultation with the doctor and then there's a prescription for the medicine and they will go to the pharmacy, but since the pharmacy they don't have their own cashier, so the patient needs to go upstairs pa, they can't get the medicine because they haven't paid it yet. So they will just show the prescription, have the medicine ready, and then get the bill for that and go upstairs and pay, and then go back again on the pharmacy and get the actual medicine and show the receipt that they paid already. So they had that one improved, which is since na may cashier billing dito sa ubos, so everything is smooth na bitaw, done downstairs, and then patient go home, wala na'y daghang adto-adtoon pa.
All right. Well, that is correct. My follow-up question to that, no, Miss Anabia, is
Yes, doc.
um, in terms of what the nurses are doing, is that part of the process flow? Is it written or it's just a practice?
Which one, doc? Because
The
that's
one
the
that goes
entire.
to the pharmacy and goes back again to the department.
Ano, that's actually the patient na, doc.
The
The
patient.
nurse, yeah, the nurse won't be doing that kay we are somehow
Okay.
short on staff manggod. So
Ah,
ang patient pa lang ang mga adtong ari. But it's for kuan bitaw, good kanang experience of the patient ba on how they get the service. So that's why we
okay.
opted not to let them go up and down rather than have everything done downstairs.
Right. No. However, is this part of the Quran? Is this part of your policy that it should be the patient who should go down or the nurse?
Actually, doc, previously, not the nurse, but the nursing auxiliaries, the assistants,
Okay.
they used to go with the patient when they go to the pharmacy. But
Mhm.
now, as I've noticed, wala na. Kay we
Yeah.
only have like one in A and one nurse in the OPD for the entire shift. So it's somehow difficult sa ilang part kay mapabayaan sa dang ubang patients once they will go with the patient nga kato ang need nga mo sa pharmacy.
Yes. No. So that can be part of a process flow. Now we can create no a particular diagram on that in which there's a particular image or a particular shape that would float. Probably it can be a diamond that goes to a different side if patients, the significant others will go down or the patient themselves will go down to do the transaction. No, however, if it's not being written into the policy, then there it might be considered as a red flag for the department. It's because it is not really stated. No, say for example, if the patient goes down, there might be some injuries that will happen, or there might be miscommunication coming from the department that they are going, or niya sila sa pharmacy, no? So they don't know what to check upon receiving those materials or those resources coming from the pharmacy that would lead to error. Or then again, it gives them again another chance to go down again to change it, no? Or it will take time and won't save their time and effort, no? That would lead to customer dissatisfaction. Right? However, if this is really stipulated into your process, we can always explain it to the significant other or the patient to go down so that they'll be able to understand that this is really the process flow, no? But if it's not the process flow, one thing for sure is that we can provide that feedback to the mancom or to the execom during their
Exicom.
meeting.
Mm-mm.
Execom, okay, execom in your end. In our end, it's mancom, and try to raise it out, no? Na we need to have at least manpower, but if it's not feasible, then tendency is what I know, it will just stagnate on that particular department and would lead to certain um it might lead to certain complaints coming from their patients, no?
But that should be
However,
the
with
standard. That should be the
yes,
standard, doc. No, I mean someone
yes,
should have, should have gone with the patient going to the pharmacy, even though they have the prescription with
yes,
them, because the errors and all, just to double
yes,
check that they're getting the right thing. But
yes. They don't know
because
what
of the.
the
Mm-mm,
details. And due to understaffing, then we do
mm-mm,
understand that. So this is really the call of human resource department to come up with a strategic plan in terms of recruitment, no? Because if that was the case, no, tendency is it would lead to complaints and unsafe practice, no?
true, true. But I haven't
Right.
seen their actual policy. I've just noticed the changes.
Yeah. That is
Mm-mm.
why if it's not written, it shouldn't be practiced.
True, true,
Like
true.
Nabi, ano? So if you
I'll
are
check
a
on that, doc. Hmm.
yes, try to check on that. But I'm pretty sure that there is no significant other or patient which is part of the policy to do that. Maybe it can be revised, probably, no? My suggestion is to revise if it's okay with the execom because decision wise it's more into the execom and it will be cascaded down to the subordinates and making policies and revisions.
Mm-mm,
And
mm-mm, true.
again, all right, thank
Thank you,
you.
doc.
Yes, let's have Tudtud, John.
Good afternoon, Doc. I would just like to share in our practice in the Department of Education. So we do have a flow chart, for example, per transaction, per department or section that the client would have a transaction. So with that flow chart, we are guided by the Citizens Charter. So it is indicated there. So the time boundiness per transaction. For example, if the uh, client would have a or would have her medical certificate validated by our physician, how many minutes or hours would she or he wait for the process to be completed? And also we implemented changes during the pandemic. We did not allow visitors to enter the office. Instead, we do it online, and all of it was memorandized, all the changes, so as to have it black and white. And also, Doc, I visited Cebu City Medical Center just recently. And since namalhin naman na sila sa bago nga hospital, I mean the new building, so ang process flow pod nila nausab na pod. And akong nabantayan, same sa kang Ma'am Onabia, when the consultant, Dr. Loreche, uh, made her rounds in the facility, nagkuan siya nga og changes like a more bitag one stop shop, doc, nga ang pasyente dili na mo adto, for example, the OPD, just like what Ma'am Onabia said, dili na bitaw mosaka sa main lobby, which is in the second floor. So nabuhat siya dito sa kubos og one stop shop na dito ang uh, social welfare, social services, the laboratory, the mga imaging, and the cashier. So dili na magsaka kanawag ang mga pasyente, doc. I believe it was also put into writing the changes. That would be all, doc.
Yes, no. So in constructing a hospital, we have to consider that outpatient department should be adjacent to the following and accessible ancillary department services. No, so good thing that CCMC, our hospital here in Cebu City, for public, no, public sector, no, was able to come up with a very good floor plan. No, so um we can consider that as a process flow, particularly in the information counter. since you're the ones who will be advising patients as to what particular direction that they need to go after they're done with the transaction from the previous department. No, so if the nursing service is taking over on that, then I cannot. If that is the policy of the hospital, that it's the nursing service to do that, we cannot do something about it, but we can always raise that na in terms of ingon on nga process, it can be done with the information or the billing department or accounting section, no? Sige, so those are very good ko ano kanang observations. All you have to do if you don't have any access to the process flow of your nursing service department or division, always make sure that as a staff in your own level, you could always ask, no, a copy on that in the nursing office. That if your nursing, your chief nurse would somehow share inputs based on its implementation. Yes.
By the way, Doc, I would
Uh,
just like to ask. I actually asked my previous professor already, and some of my classmates know about it already. But we're actually looking for a chief nurse. Maybe you know someone.
or a chief nurse in your hospital.
Yeah, because our chief nurse actually immediately resigned once he got his visa going to Ireland. He flew fast.
Mm. Okay. Wala din may graceful exit din ha. Like,
Siya, Doc, wa siya ni graceful exit.
uh,
As
kasi
in,
if there is an approval coming from the HR, they can tweak the policy, no? So, lisod, ugingon ana, paspas kaayo,
mm,
wala.
mm. Maybe you
Um,
know someone, Doc?
yes, maybe, no, we can let them apply based on the qualification as to what is in that position, Jude, no? What are
Yes,
the
Doc.
qualifications? That's very important, especially the
Mm,
skill, no?
mm.
I'll try to find one, no? But
Thank you,
I
Doc.
cannot assure, no? Isa ka
Mm.
ka. Why not have it in your own na lang, in your own department? We need to have succession planning for that. Meaning to say, if somebody is not there anymore, there should be somebody who should be appointed based on the succession planning.
Actually, there is an OIC currently, Doc. She is the deputy chief nurse, but the thing is, she's not actually fully qualified since she hasn't finished her master's yet. I think, I'm not even sure if naka-finish siya og 21 units.
Okay.
Mm-mm.
Probably we can what you can do Anaha is that since she haven't finished yet and she is the OIC right now as a chief nurse, HR
Mm.
can do something about that, no, in terms of um if she's really interested with the position, HR can somehow provide, no, a memo to her in terms of the compliance of finishing her degree or Masters of Arts in Nursing, no?
As of
Because
ongoing. Mm.
yes, ongoing siya. Anyway, the OH would somehow consider that if there are no applicants, no, knowing that HR is posting on social media or even trying to do recruitment based on their communication through the bulletin
Mm-mm.
board, no, or through the word of mouth of the staff, there's no applicant, no. Tendency is we can still consider her, but provided that she has a contract and would somehow say no, um, we will proceed with it. No, yes, memo of undertaking. Actually, we do have that. Um, we do have that one, no, in our hospital as nurse supervisor who wasn't qualified due to no masters, no
Mm.
master's degree. So what DOH did, there was a memo of undertaking that was issued to him to finish his degree for 2 years. And right now, he is almost
Mm.
already in his thesis, no? So kana siya.
Mm. So, pwede ra jud.
Mm. Yes, no? So try to consult it with your legal. Kung pwede siya, try to let them find, no?
But maybe you also know
Suitable.
someone if ever, Doc.
So for those who are pwede ra pod siya. Oh,
Mm-mm.
sige.
Thank you,
Lahi
Doc.
kayo og ang culture ang gikan sa gawas, no? Murag
Actually,
kanang na
gikan sa gawas ang among medical director, Doc. That's the thing. Because
ah,
he's very open bitaw with things ba, like panggawas nga style, in which it's very difficult actually for others to grasp since di kasi lang anak ka open or something like that. So,
Mm.
kung gikan man gani isa gawas if ever, I think okay.
Yes, pwede kayo siya, no? But there will be lots of adjustment should if ever gikan sa gas. But if gikan siya sa inyo, ha, maybe nalay gamay na mga add-on kabaw na siya sa pasipot. That's what I highly suggest as part of succession planning. That is why Miss Unabia, no, I suggest that in your department you should find somebody who is the next successor if you will be planning to resign. So at least you will able to train him or her already. Preparado
Mm-mm.
ready to finish.
Mm-mm. Sige, 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 Doc. Thank you, Doc.
Yeah. Alright. Nakita ka ng chief news. Ikaw na lang mo apply ka.
Nah, I'm not ready, Doc. Not for the next 5 years.
On I suggest na humanon sa nimo imong masters kung ma-chief nurse na ka, labad na kay na sa ulo. Wala
Tinuod,
na
Doc.
kay time. At
Ko,
ingimuhaan na is mga problems kay ikaw na ba walay proper endorsement kinawa na siya kalit, no?
tinuod. Mm.
Yes, sao na lang ng endorsement jud, no? Sa amuan na jud may endorsement 1 month jud na siya ang graceful exit period.
Actually, yes. Minimum should be 1 month. For special areas, that should be 2 months.
Yeah, then if that is the case, if the staff nurse couldn't serve, what we usually do is we don't issue certificate of employment.
Yeah, yeah, si Ui.
Mhm.
Tinuod,
And
tinuod.
that's just our hold, no, in terms of the organization. Kaya parang,
I think he did not need it, Doc. That's why he doesn't care if he will get CUE or not because he work he works as a staff manggod there. So he doesn't want, the people there also to know that he is on that position here in the Philippines. Like chief nurse na siya, something like that.
but who will issue his is he a staff nurse before in your hospital before he became a chief nurse?
Oo, naka-staff siya, Doc.
Kato siya hold na dili na to siya ma-release, no? That's my suggestion, no? If I'm the acting OIC chief nurse, I will be informing HR not to release it unless, no, na if there are any breaches of contract that he needs to pay, kana siya, pwede na to na i-consider. Pero kung wala, si OA jud tapos they'll go there to do the clearance, not clearance signing.
True, true. Ambot ato niya. Anyhow,